Why do histamine intolerance symptoms overlap with other allergies? Have you ever wondered why symptoms of histamine intolerance seem so similar to those of allergies? This is a common question, and understanding the connection can help clarify things. Both conditions involve histamine, a chemical that plays a key role in allergic reactions. When your body encounters an allergen, immune cells known as mast cells releases histamine. This releases causes blood vessels to become more permeable, leading to inflammation and typical allergy symptoms like a runny nose, itching, and hives. However, histamine intolerance is a bit different. In this case, the issue is not an allergic reaction but rather a reduced ability to break down histamine effectively. This often happens due to low levels or impaired function of enzymes like diamine oxidase, which normally help degrade histamine. When histamine builds up in the body, it can trigger symptoms that closely resemble those of allergies. These symptoms can include skin reactions such as itching and hives, digestive issues like bloating and diarrhea, respiratory problems like nasal congestion, and even cardiovascular effects like rapid heartbeat. The reason for this overlap is that histamine affects various tissues and organs through its receptors. So, when histamine levels are high, the symptoms can mimic those of an allergic reaction. The overlap between histamine intolerance and allergies occurs because both conditions involve elevated histamine activity. However, the causes are different. Allergies are immune responses to substances that are usually harmless, while histamine intolerance stems from the body's inability to metabolize histamine properly. This shared mechanism helps explain why symptoms like itching, swelling, and gastrointestinal distress appear in both cases. From an allergy standpoint, histamine is a major player that causes the classic signs of allergic reactions. It increases blood vessel leakiness and inflammation, helping the body to expel what it perceives as threats. In contrast, histamine intolerance leads to excess histamine triggering similar pathways without an external allergen stimulating the immune system. This results in what some call pseudo-allergic symptoms, which look like allergies but do not involve the typical immune response. Understanding this overlap is essential for effective diagnosis and treatment. Managing allergies often involves avoiding triggers and controlling immune responses. On the other hand, addressing histamine intolerance may require dietary changes to lower histamine intake and support its breakdown. Recognizing the central role of histamine in both conditions helps clarify why their symptoms are so alike and why careful evaluation is necessary to differentiate between them.